In the world of healthcare, where the fight against cancer is relentless, the safety of those administering life-saving treatments is paramount. This presentation is dedicated to the critical practices and precautions required for the safe handling of cytotoxic drugs, powerful agents that, while essential in cancer treatment, carry significant risks if not managed correctly. To understand the importance of these safety measures, let's first take a closer look at the current landscape of cancer globally and in the Philippines. In 2022, 19.9 million new cancer cases and 9.7 million deaths were recorded globally, with 53.5 million people living with cancer. The Philippines alone saw a rise from 141,021 new cases in 2018 to 188,976 in 2022, highlighting the growing impact of cancer. Looking forward, it is predicted that by 2050, over 35 million new cancer cases will emerge, a 77% increase from 2022. This underscores the urgent need for effective cancer treatment strategies. As cancer cases rise, so does the need for various treatment modalities, including hormone therapy, surgery, bone marrow transplantation, chemotherapy, targeted therapy, radiation therapy, and immunotherapy. However, chemotherapy, while effective, poses significant risk to healthcare workers. Cytotoxic drugs are highly toxic, known for their ability to damage or kill cells. They pose health risks such as carcinogenicity, genotoxicity, teratogenicity, reproductive toxicity, and organ toxicity, particularly to those who prepare and administer them. Exposure to cytotoxic drugs can occur through skin contact, skin absorption, inhalation, ingestion, and needle stick injuries. All of the mentioned modes of exposure can occur during drug preparation, drug administration, handling patient waste, transport and waste disposal, and spills. To prevent exposure, implement engineering controls by using Class 2 or 3 biological safety cabinets, also compounding aseptic containment isolators, closed system transfer devices, and needle-less systems. You can also do administrative controls by implementing work practices, management policies, and training programs to reduce worker risk. And lastly, use personal protective equipment or PPE. These measures are vital in protecting healthcare workers from hazardous drug exposure. Proper PPE use is critical when handling cytotoxic drugs. Ensure that the PPE fits correctly and is used as per hospital protocols. PPE should consist of 2 pairs of non-latex gloves, N95 mask, protective eyewear, hair cup, impermeable chemotherapy gown, and shoe cover. For mask, NIOSH certified N95 protective respirator is needed. Surgical mask alone does not provide respiratory protection from drug exposure, hence should not be used during drug preparation or administration. Protective eyewear is needed whenever hazardous drugs may spill to the eyes or face, especially during drug preparation. Hair covers are constructed of coated materials and is used to reduce the possibility of particulate or microbial contamination. For the non-latex gloves, use powder-free gloves since the powder can contaminate the work area and can absorb and retain hazardous drugs. Disposable gowns made of polyethylene-coated polypropylene or other laminate materials offer better protection than those of non-coated materials. They should have long sleeves with tight-fitting cuffs. It should not have seams or closures that could allow drugs to pass through. Don't use cloth laboratory coats, surgical scrubs, or other absorbent materials that permit the penetration of hazardous drugs and can hold spilled drugs against the skin and increase exposure. Use shoe cover only on the compounding area to avoid exposure of non-protected workers. There's also protocols for the safe administration of cytotoxic drugs. It's crucial to follow strict guidelines when handling these powerful medications. Never disconnect the tubing from cytotoxic drug bags unless a closed system is in place. Discard the drug bag along with the attached tubing into an appropriate waste container to avoid any unnecessary exposure. When handling oral cytotoxics, take extreme care to avoid skin contact. Always use methods that prevent the liberation of aerosols or powders into the air. Cross-contamination with other medicines can be dangerous, so take care to keep them separate. In the event of a spill, proper spill management is essential to prevent contamination and exposure. Here's the step-by-step process of spill management. Step 1. Warn everyone nearby to stay clear of the spill area. Step 2. Call for assistance and request a spill kit. The requested spill kit should contain instruction sheet, cytotoxic drug spill sign, water for powder spills, detergent or cleaning solution, personal protective equipment set, absorbent materials, hazardous or cytotoxic waste bags, a small scoop or scraper for contaminated objects. Step 3. Display the hazard sign to know where the spill is. Step 4. Put on personal protective equipment or PPE. Step 5. Contain the spill. For liquid spills, place absorbent cloths around the perimeter and cover the spill with absorbent materials. For powder spills, use an absorbent mat and lightly wet it to minimize dust. Step 6. Prepare the waste bag. Open 2 cytotoxic waste bags and place one inside the other. Step 7. Gather the absorbent material. Discard collected waste into the inner waste bag or cytotoxic sharps waste container. Step 8. Rinse the area. Clean the contaminated area multiple times with water and detergent, starting from the outside of the spill and moving inward. Rinse thoroughly with water until it's completely clean. Step 9. Dry the spill area. Dry the affected area with absorbent towels or other suitable materials and dispose all items into the inner waste bag. Step 10. Seal the inner waste bag. Step 11. Remove additional PPE, placing into the outer waste bag. And if your hands become contaminated at any point, wash it with soap and water. Step 12. Seal the outer waste bag, then put it inside the appropriate waste bin. Step 14. Perform hand hygiene after. For cytotoxic spills, use soap and water only. For spills that pose a biohazard risk, wash hands with an alcohol-based antibacterial solution. Decontaminate also any additional equipment. Don't forget also to replace the spill kit. And lastly, make an incident report. Dispose cytotoxic waste correctly and follow all protocols for handling accidental exposure. Quick and correct action can prevent serious health risks. In the event of a needle stick or sharps injury, let the wound bleed freely. Under running water, gently and thoroughly wash the area with soap. Contact occupational health. Ensure that facility policies for needle stick or sharps injury are followed, including completion of an incident report and reporting to the Workplace Safety Insurance Board if indicated. Ensuring safety in handling cytotoxic drugs is a shared responsibility. Let's work together to maintain a safe environment for both healthcare workers and patients.